There are two types of prescriptions. There are acute prescriptions and repeat prescriptions. Acute prescriptions are given to you at the end of an appointment with a doctor or a nurse to treat one or maybe more things that you come in with. So, for example, you may have a urine infection or a rash that needs a prescription. Repeat prescriptions are regular prescriptions that are usually medicines that are taken on a daily basis and need to be refilled every so often. And as a surgery, we tend to give 2 months of medication as a maximum. And it's very important that you know when you're taking repeat medication, when you're due for a medication review, and how to order those prescriptions so that you don't run out. Now, we would say that you ought to allow 3 working days before expecting a repeat prescription to be made ready for you. There's a newer way of doing that. So historically, we printed out on those green prescription pieces of paper, you come in and you collect it and take it to the pharmacy. There's now something called the Electronic Prescription Service, or EPS, and that means that most local pharmacies are signed up to an electronic system that communicates with us. And again, if you allow 3 working days, you can actually order your prescription online and it will be ready for you to collect at your pharmacy. The thing to remember with this is that you need to nominate a specific pharmacy and stick to that pharmacy for all your repeat medication. Not all medications are available on the NHS, and there are a number of reasons for this. One is cost, and actually the NHS tends to use a system of formularies, which means that we are bound to prescribe from a set list of medications. So a lot of things are not really allowed to be prescribed on the NHS, and part of that is cost. Another reason is that you may have gone and seen a specialist in the private sector who's recommended a particular medication. They are not always licensed for the same use by the NHS, and in that instance you would actually have to collect the prescription from your private provider.